Hello, I am Monica Baluyot of PS and Tracy of Group 9, and today I will perform a caring for gastrostomy tube. First of all, we have to assemble equipment, verify the medical order or facility policy and procedure regarding site care, perform hand hygiene and put on PPE if indicated, identify the patient, explain the procedure to the patient and why this intervention is needed, and answer any questions as needed. Assess patient for presence of pain at the tube insertion site. If pain is present, offer patient analgesic medication for physician's order and wait for medication absorption before beginning insertion site care. Pull the patient's bedside curtain. Raise bed to a comfortable working position and usually elbow height of the caregiver. Put on gloves. If gastrostomy tube is new and still has sutures holding it in place, dip cotton tip applicator into sterile saline solution and gently clean around the insertion site, removing any crust or drainage. Avoid adjusting or lifting the external disc for the first few days after placement except to clean the area. If the gastric tube insertion site has healed and the sutures are removed, wet a washcloth and apply a small amount of soap on the washcloth. Gently cleanse around the insertion, removing any crust or drainage. Rinse the site, removing all soap. Pat the skin around insertion site dry. If the sutures have been removed, gently rotate the guard or external bumper 90 degrees at least once a day. Assess that the guard or external bumper is not digging into the surrounding skin. Avoid placing any tension on the feeding tube. Leave the site open to air unless there is drainage. If drainage is present, place 1 thickness of pre-cut gauze pad or drain sponge under the external bumper and change as needed to keep the area dry. Use a skin protectant or substance such as zinc oxide to prevent skin breakdown. Remove gloves, lower the bed and assess the patient to a position of comfort as needed. And lastly, remove additional PPE if used and perform hand hygiene.
Hello po, Nay. Magandang umaga po. Ako po si Nurse Monica, ang nurse niyo po ngayong araw. Nay, pwede ko po ang malaman ang pangalan ninyo?
Maria Buena po.
Nay Maria, tanungin ko po kung kailan po kayo pinanganak?
June 1, 1981 po.
Okay po, confirmed.